The third section to Chapter 11 is going to review the abdomen. This is the area below the diaphragm and above the pelvis. It contains the stomach, small and large intestines, liver, gallbladder, pancreas, kidneys, and spleen. Typically, the individuals that we interact with will not have injuries to this area, but we should still be aware of what can possibly occur in these areas depending on our setting. Those that are in maybe physical therapy, working with an older population, we may just see run-of-the-mill injuries that the athlete or individual will ask about as they're getting treatment for something else. So we still need to be aware of it to help that individual out. So the first section that we're going to look at reviews the kidneys and the urinary system. And by any means, I'm not going over a lot of this stuff. I kind of picked a couple out, so it's a very short section. But let's look at some of these injuries to the kidneys and the urinary system. When we look at the kidneys, this is a really serious injury. If the kidney doesn't have time to heal, or if it has a very traumatic injury to it, there could be very, very bad complications from it. And kidney function can deteriorate, the kidney can fail, we could have bleeding in the abdominal area from the kidney if it's lacerated. So it could be a very traumatic injury. So we look at mechanisms, typically from a blunt force trauma. And if you look at the typical equipment that we wear, it stops right under the last rib. And there's not a lot of protection below that, so below the ribs and the hip area. So this is where part of the kidney lies. And if we do get some sort of injury, maybe a punch or some sort of blunt force trauma with an implement, it can cause injury in this area that can cause that kidney to be lacerated. It talks about in the book that this section of the body is called the flank. So when we see pain or possible complaints of pain in the flank area, it could be a kidney contusion. Athlete may also be complaining of nauseous feeling, difficulty breathing, vomiting, hematuria, which is blood in the urine, ecchymosis, and swelling. For treatment, we want to make sure we discontinue contact activities, rest, ice the area, take over-the-counter non-steroidal anti-inflammatories, and refer the person to a physician. Prevention, as best as we can, we want to wear protective gear around the flank area, strengthen the musculature around the area so we have a nice thick wall of muscle to help protect the kidney from blunt force trauma. Some of the more kind of everyday problems that we can see are going to be what we talk about next. First are kidney stones. Doesn't mean that we're going to see them in the athletic type of individual, but kidney stones are formulated in the kidneys, but they can be found anywhere in the urinary tract. And really what causes a kidney stone is the urine containing too much calcium or uric acid. And this calcium uric acid buildup produces these stones within the urinary system. So we see signs and symptoms of agonizing back pain, nausea, vomiting, chills, some like flu-like symptoms, but they're very painful as the person passes the kidney stone. When we see treatment, we're going to see if the person can pass that kidney stone, but also have the athlete evaluated by a physician. Conservative treatment includes passing the stone through the urinary tract on its own. They may be in a lot of pain, so the physician may prescribe them some sort of pain medication. But if not, the physician will do further treatment for that individual. For prevention, we want to make sure that we flush out a urinary system by drinking water and making sure that we produce the adequate amount of urine. Next one we have is UTIs. Again, not necessarily common or not necessarily specific to athletes, but when we look at UTIs, this is an infection occurring in the urinary tract. It occurs more often with females, but males can also have a urinary tract infection, and these are caused due to bacteria getting into the bladder, causing cystitis. And cystitis is just inflammation of the bladder, but it can also be caused by bacteria getting into the urethra, and this is referred to as urethritis, so inflammation of the urethra. Signs and symptoms that we see is pelvic pain, severe pain and burning with urination, constantly feeling the need to urinate, and the urine actually being a pink or cloudy in color. Treatment, we just refer them to a physician. They may be prescribed antibiotics, or they may have to be hospitalized if it's severe enough. Prevention, drink water, kind of like kidney stones, empty bladder as soon as the person gets the urge to urinate. Next, we're going to move on to the digestive system, and we just have a couple things in the digestive system. What I'm not going to go over is your typical vomiting, your diarrhea, or your constipation, but I'll pick some other ones out that we'll talk about. So the first one that we are going to look at is a peptic ulcer. And peptic ulcers are sores in the lining of the esophagus, stomach, or upper small intestine, so right after the stomach. And when we see a peptic ulcer come about, it's usually due to bacterial infections, especially H. pylori. And when we have H. pylori, stomach acid can be built up. And another cause of a peptic ulcer is overuse of aspirin and other NSAIDs, which can wear away the stomach lining and the upper digestive tract, because that's where a lot of that breakdown process occurs. Chemicals from smoking can also cause it, as well as such as tobacco and other drugs as well. Signs and symptoms that we'll see: burning, pain at the upper digestive tract, lack of an appetite, they don't want to eat, and then athlete typically loses weight because they have this lack of appetite. More severe types of peptic ulcers can have bleeding. This could be in the stool of the individual, and if the bleeding occurs through the stool, the athlete will have dark black colored stool because the stool is being mixed with that blood. If they do vomit it, they can also vomit it up, and the vomit blood will be very red in color. So we can see minor, they have burning pain, to severe, they may have vomiting or bloody stools. For treatment, there's a lot of over-the-counter antacids that we can be used to see if we can decrease some of the signs and symptoms. If that doesn't work out, we can have that athlete be evaluated by a physician. Prevention, try to cut down on use of NSAIDs, and then we need to, if we still need to take it for an injury or something, then we should consult with a physician about taking NSAIDs and if they have a pre-existing ulcer. Also, we need to worry about proper hand washing and not smoking, because these are also other ways that a peptic ulcer can come about. Gastroenteritis, or what we typically refer to as food poisoning, is stomach and small intestine inflammation, and it is caused by eating contaminated food. And I included this because there's a lot of athletes that go on road trips and they eat out, or they're eating something that's been sitting there for a while at the field. So it is more common than you think, and it could be very detrimental to an athlete if they have food poisoning on an away trip. So for a mechanism of injury, it could be caused by bacteria, viruses, or parasites that enter the digestive tract. And these bacteria, viruses, or parasites are on food that is contaminated with these bacteria or viruses. And it can also be from poorly prepared or uncooked food, as well as these viruses or parasites in the water that's being used to prepare the food, or that the athlete is drinking at competition. A person can also pass a contaminant to another person. So again, proper hand washing if the person has this bacteria and handles the food and gives it to another person, they can be transferred that way as well. Signs and symptoms: athlete has abdominal pain, nausea, vomiting, and diarrhea. Typically flu-like symptoms that will come and go quicker than the flu would. For prevention, what we want to see with prevention is that for treatment, that really it commonly relieves itself. Apologize for the typo. That should be treatment. Commonly relieves itself, but the athlete should ingest electrolyte fluids to keep their fluid level up and ease into eating normal foods again, so it doesn't irritate their digestive system. For prevention, we want to make sure we frequently wash hands, know where our food's coming from, and just be aware of anything that can upset the individual's stomach, such as foods, medications, or toxins. Next, we have GERD, or gastroesophageal reflux disease, and this is a peptic esophagitis and dyspepsia. And really, what happens is the person has indigestion. Most people just say, "Oh, I have indigestion or heartburn." This is what GERD is. And what happens is when we ingest food, is that the food goes through the esophagus, through a sphincter into the stomach, and if that sphincter at the top of the stomach does not close properly or becomes open for any reason at all, that food comes back up, as well as the acid from the stomach that's breaking the food down, and it causes that burning reflux sensation into the throat. So the athlete feels a burning sensation or heartburn if that acid comes up. We'll look at mechanisms. Typically due to drinking alcohol or smoking, can also be caused by obesity, pregnancy, and various medications. But signs and symptoms: we have heartburn sensation, which is a burning sensation in the esophagus, indigestion when regurgitating food, or the sensation that food is stuck in the esophagus. Treatment: we can take over-the-counter acid reflux medications to decrease the acidity that's coming up with GERD. We can also have the athlete lose weight if they're obese, quit smoking, and drinking excessive alcohol. For prevention, we can maintain a healthy weight. We want to make sure that they eat slowly at meals and do not drink excessively and do not smoke. Lastly, we have irritable bowel syndrome, and this is a common condition of the large intestine. So as you see, we've worked down the digestive tract, and now we're at the end of the digestive tract. So this is a common condition at the large intestine, and IBS does not produce inflammation, but it is very irritating. We don't know why it occurs, and there's no really known cause of why it occurs, but it does typically occur more in women than in men. So even though we don't know the cause of it per se, the athlete or an individual has some sort of trigger that can exacerbate IBS, such as gas, certain foods, stress or other emotions, medications, and specifically in women, hormone changes. But IBS could also be hereditary and can run in the family. We look at treatment. We want to treat the symptoms of whatever the athlete is going through. So if they're going through abdominal pain and cramping, we want to make sure that we treat that. If they're going through diarrhea, we want to treat that. Constipation, treat that. And if the signs and symptoms still persist, we want to make sure we refer them to a physician if they persist over a longer period of time. For prevention, we want to make sure that we participate in physical activity, do regular relaxation activities, eating small meals throughout the day instead of big ones, making sure that we drink enough water, avoid foods that we know cause IBS signs and symptoms. All these ways that we look at these precursors. If it's something that helps with the precursor, then we want to make sure that we do that to avoid IBS occurring.